pulling the joint surfaces perpendicular to this straight line. So that's to increase general mobility. Dorsal glide is bottom and the board glide is on page 2. So we'll do dorsal glide first. So which way is dorsal? Take a dorsal fin and then dolphin. So towards the back, right, that's dorsal. And then the other term we're going to go to is volar. So volar means in the front. So we're going to I like to do this inside line in the 5:30. Doing it supine, which is great. I like to do it Thanks. I'm going to palpate the radial head. Go behind the radial head. Dorsal glide. We'll do volar glide first since I'm on this side of it. I'll do it from that side too so you can see. So volar would be anterior. So I got one thumb on the radial head, and then my other thumb is on my other thumb. And then I'm just pressing straight anterior, or volarly. So volar glide of the radial head. So dorsal glide would be the opposite. So doing the volar glide, I feel like it's easier because you can palpate the radial head from that side easily. Whereas when you're on this side, there's more soft tissue to get through. So I like to take one finger and palpate the radial head from the back side. And then grab onto the front with my thumb. The idea is the same. We're going, your thumb is your contact point, and then your other thumb is on your first thumb. And then we're doing a dorsal glide. Right? Okay. So with my right hand, I've got my thumb, I got my index finger on the radial head, okay, in the back. I've got my thumb kind of pushing through the soft tissue, sorry. So I'm doing almost kind of a pinch with both fingers. And once I get my contact points, I'm moving kind of both fingers like that, not this way. Once I get that grip, I'm pushing dorsally, okay? That's why I say this direction is a little bit harder, because from the other side, if you're going to do the volar glide, the radial head's right there, it's easy. There's basically the head, skin, and that's it. So it's easier to feel, and you can push directly on it. But from the other side, you're going to have to get a better grip on it. Okay? Here, when you start doing that, start from this side. The dorsal glide would look like this. So my index finger is on the radial head here, then my thumb, I'm kind of getting into the radial head from the front. I've got that pinch, right? And then my thumb, this thumb is on my right hand thumb. And I'm doing the dorsal glide that way.
Are you more like triangulating like this or just pushing forward? Just pushing. Okay.
And also they say that when supine with the volar glide, it's pulling, as opposed to when I was doing sideline volar glide, I was pushing. Does that make sense?
Yeah. It kind of depends on what's supposed to
So it's a little different. So with this, in supine, you could do them both at the same time, or back and forth. I suppose you could do it back and forth in sideline too, but
You can sit with the supine technique too, if
Mhm.
I'm feeling tired of finishing. Yeah, you can still palpate these pretty easily. Same exact things Dr. Fonts just showed, just in a different position. And you're seated instead of standing now too, and the patient's supine instead of side lying. Through all that soft tissue, right? Brachioradialis, coronary arteries. That can be a little touchy for some patients if they've got any median nerve entrapment in the coronary arteries. Watch out for that. They might get zingers down their first three fingers.